One reason why a patient is not compliant is the quality of the patient education, the extent of information that the patient knows. Actually, most of the reasons are related to the patient education in some way or another. For example, how much the patient knows about the word biological, because according to patients, the word biological is linked to like biological weapons, for example. So you have to explain that this biological, it's antibodies that are prepared in the lab, and how the procedure is done, to, because they want to be familiar with the word biological, because maybe someone will warn them of this term, like they are sometimes afraid of the term chemotherapy when you give them methotrexate. Another cause is the patients need an explanation for the high cost of the medicine, why the preparation of those antibodies is costing so much money. Because if you're taking a medicine and you discover that it is for such a high cost, you will think that you're having a serious disease, and you might think that they're making experiments in your body. So you need that kind of explanation. You need reassurance. Of course, a quality patient education always depends on certain abilities of the doctors, not only the information that the doctor has. It's related to his abilities to have to maintain good rapport, to create and maintain good rapport with the patients. Of course, even before you start biological treatments, we assume that the patient knows that this is a chronic disease. It might have ups and downs, it might have flares on and off, but this is a chronic disease, and the patient should be on a regular treatment. He should not stop the treatment. The issue of how long I will be on a biological treatment, well, it could be lifelong, but if you tell a patient it is lifelong, this is frustrating to many patients. It makes them feel that this will be always, and the medicine is very expensive, and he's wondering if the insurance company will cope with this, will always give them the approvals. We will be on this treatment for 2 years for a start, and then we will discuss. And you have to explain to them that the doctor is the one who stops the medicine, or who is making the treatment decisions with the patient, but not the patient on his own, never. It's very important to explain to the patient who is the person who is responsible for patient education. It should be a patient. It should be a rheumatologist. Definitely it's not his friend, definitely it's not his neighbor, and definitely it's not another physician from a different specialty. It's a certified rheumatologist, maybe a rheumatological patient educator. And there's another issue, the date of the follow-up visit. Say I tell the patient, okay, we will see you after 2 months or 3 months. So the patient has to know that the date of the follow-up doesn't mean that this is the end of the prescription of taking the medicines. It's only a day to follow up. On the day to follow up, I will see the patient, and after the assessment, we will fine-tune the prescription and make treatment decisions. But if he's delayed for the follow-up visit, say instead of after 2 months, he will come after 4 months for any reason. We tell the patient, okay, you will be taking if for any reason you are delayed, you will be taking your medicines on a regular basis till I see you. Because sometimes a patient, you tell him after 2 months, he would come after 3 months. He tells you, yes, okay, I took the medicine for 2 months, and the 2 months were over, so I finished. And now he's coming with 4 weeks of treatment. Some patients, here in Jeddah and in our hospital here, we are seeing patients from many different nationalities, and those patients, they go on vacations at least 1 month per year. Sometimes their wife is the one who is receiving the medicine, and she would go for 4 or 5 month vacation. Sometimes the patient would go for a vacation, and we get him an approval for an extended period of treatment for like 2 or 3 months, but then he will go and return back delayed 1 or 2 months, so he will be off his medicine for several weeks, 8 weeks, for example. We have some, this is a chronic disease. You might be frustrated, especially if you get a lot of flares or the treatment is not effective enough. We assume it is effective and there are no side effects, but sometimes the patients, when they get flares, they are frustrated and they respond to the common notion that this is, or the common concept that this is a chronic disease and there is no treatment for it and it's only painkillers. Some patients, they give up and they would come, we say, we stop all medicines, which is really frustrating for us also. This is a very peculiar reason that I got from my database, but 3 patients, out of 130 patients, they said this, so I think it deserves to be considered. Those patients, they live in remote areas, and the lady would say, no one to take me to the hospital to take the injection. They live in very remote areas, and there's no one to give the injection at home, so they have to take her to a polyclinic. So sometimes she's delayed for 1 week or 2 weeks for every injection. Well, it happens sometimes. So those are the most common reasons for problems with patient compliance.